Good morning, everyone. Happy to be here this morning with you. So, Puerto Rico has often been described as the canary in the coal mine. You can look up what the canary in the coal mine's role was. I see some of you Googling it. It can be a little dramatic, but at the end of the presentation, you will understand the analogy and what we are trying, the message we are trying to give you this morning. It has been a real-time test of how the program performs when it reaches its maturity. So moving, let's see. Oh, it has. Let me go ahead. Is it moving?
There we go.
There we go. Perfect. Sorry for that. So, this morning we want to cover four, and it's going to be brief, parts. First, why and how the Medicare Advantage program is different in Puerto Rico. Second, how Puerto Rico illustrates the strength and the promises of the MA program for a wide population. Third, the vulnerabilities of the Medicare Advantage program in Puerto Rico that are likely to spread nationwide. And finally, some recommendations to protect the promise of the Medicare Advantage program in Puerto Rico and nationally. Just moving. Okay, so images speak more than words. As you see from that pie chart, 96% of beneficiaries that are enrolled in both Part A and B have a Medicare Advantage plan in Puerto Rico. That's a huge number. 99% of duals choose a DSNP. That's the largest dual population in the United States. So why is Medicare Advantage so popular in Puerto Rico? 42% poverty rate will explain a lot, right? Many seniors cannot afford Part B premiums before the Medicare Advantage program was put into place. As a territory, Congress at some point determined that Part B was going to be optional because of that same reason. As a territory, Puerto Rico lacks access to several key federal healthcare programs. There's no Part D, no income subsidy. There's no Medicare program, savings program to cover the Part B. No long-term services and support. And no supplemental nutrition assistance programs. So, most of the time, Medicare Advantage is the only way many seniors in Puerto Rico can afford essential healthcare services and out-of-pocket costs. But in this environment, that you can imagine how challenging has it been, Puerto Rico has built one of the most integrated and cost-effective Medicare systems in the nation. It's the second largest fully integrated dual-eligible special needs program after California. California, Puerto Rico. And we have done it. This alignment makes Puerto Rico and demonstrates that the type of Medicaid integration that CMS and Congress seeks to replicate nationally. And we're going to speak a little bit about that challenge when you have this already, this outcome already, and the changes that are coming, how challenging can they be for us? And we are very proud to say that even in the environment and even with all these challenges, this is kind of a little bit slow. There you go. So Puerto Rico, all companies, all the Medicare Advantage companies participating in the program have 4.5 stars or more. That's 13%, the difference about 13% of plans nationwide. So we are very proud of what we have achieved. We are proud of that. We have achieved that. But the success story exposes vulnerabilities and challenges. And I'm going to let Carlos go through those challenges with you.
Thank you, Solange.
Sure.
Great to be here and great to share the stage with my partner here. So yeah, that was a great frame up, but let's talk about the challenges. So for the first time in 3 or 4 years, we received good news with the rate announcement. So it was more positive than what anybody was expecting. What's the backdrop of this? Is the 3rd year of implementation of V28. As you know, V28 has been sort of controversial. And right over the horizon, we're seeing a new encounter data risk adjustment system being conceived, and we might learn some about it in the next advance notice. So even though we had sort of a reprieve with the rate increase, the environment is very challenging. In addition, the rule to have one integrated dual SNP per each service area presents several challenges. We shared this in our enrollee advisory committee, and you should see the beneficiaries' faces when they were told, well, now you have to pick only one plan. And we went through a dynamic to have them design one plan. It was impossible. So very challenging. Additional challenges. So the charts you see here are, you take the county benchmarks from all over the nation, from Alaska all the way to the last state, and you graph them. So if you see that trough there in sort of the right-hand side of the chart, that's the Puerto Rico benchmarks. And these benchmarks have gotten or have fallen further back since the inception of the ACA. So we're really lagging. I'd ask you, Google Puerto Rico Trench. The Puerto Rico Trench is the deepest point in the Atlantic Ocean right off of Puerto Rico. So that's the second Puerto Rico Trench. And it stands in stark contrast to the rest of the nation. Okay, so this is another way to see this. So this is over time. We call this the ribbon chart, and it shows the benchmarks for a handful of representative states. And it shows Puerto Rico, even though we have been increasing, and that is positive, and that has helped us provide the services we do provide and reach the stars Solange talked about, we still fall further behind. So if you extrapolate this a few more years, we'll be at half or less than half of what the states receive. And you can't offer the same level of quality and services without having impacts. The impacts we see, by the way, are doctors and nurses flocking over here. So that is a challenge. Another way to look at it, and this was created by one of our statisticians, and this is a probability chart. So on the x-axis on the bottom, you see the benchmarks. And wherever the point appears in the graph is how likely from that blue chart where you saw the counties you are to fish one benchmark. So what all this is saying is the probability of getting a benchmark at $750 is almost zero because the only one there is Puerto Rico. Everybody else is clustered on the right side of that chart. And again, it just causes us concern, and it becomes a second-tier system. Okay, so the circularity problem, and there have been various studies on this. Economists have tackled it, and actuaries have helped too. There's no light at the end of the tunnel here. So in a circle, you just keep going around. It's like staying in the same groove on a record. And lower benchmarks leads to lower funding leads to lower wages, and on and on. So something has to happen to get us out of this problem. And one of the solutions is to tether us somehow to the mainland, but we'll get into that. So here are the solutions. there are almost 700,000 MA beneficiaries in Puerto Rico, so that's not a small amount. So whenever there's a policy, please don't overlook the impact on Puerto Rico, and if you read the call letters and the rate announcements, they address us, and we appreciate that, but just don't forget about us. Another idea that has been lobbed for several years has been setting a national floor. So we see some counties, some in Texas, some in Wisconsin, that are sort of nearing Puerto Rico levels, and we wonder if there's an anomaly in the data where you're using fee-for-service to set that benchmark, and perhaps we are a bellwether of things to come. So we have to start thinking about, in addition to setting a national floor, we need to move towards reform, and reform has been spoken about at length. And we need to begin setting MA benchmarks on something other than fee-for-service claims, because otherwise you'll see where we end up in that chart. So I hope this sort of crystallizes the situation we're in, the opportunity nationally, and I hand it back to Solange for our closing.
I love that picture, and I'm sure now you understand the analogy and what we were talking about. So we do have been the canary in the coal mine for the Medicare Advantage program for a long time now. So what's the lesson today? Listen, and you have, and thank you for that. But now we need to act. Because what happens in Puerto Rico doesn't stay in Puerto Rico, at least about this. It will echo across the nation. So let's get the canary out of the coal mine. Can you do that for us? Can you help us? Thank you. We have a lot of work to do.